Medicare is wonderful insurance and covers the great majority of services that you're going to need for your health care. But are you prepared for the 4 things that Medicare will not cover? In this video, I'm going to show you how. Now, the first item I want to address will be most dental services. In fact, original Medicare is very, very limited on what they will cover when it comes to dental services. When you think about extractions or fillings or root canals and crowns and those kind of things, Medicare is not going to cover those items. Really, the only thing that original Medicare A and B is going to cover would be if someone is getting ready to have a heart valve replacement or kidney failure and they're going into surgery to have their kidney removed. That's called end-stage renal disease. They're going to need to have some pre-dental work before that surgery, and so Medicare is going to cover that. If someone has some kind of serious like jaw cancer and the jaw bone is going to have to be removed or partially removed, there will have to be some reconstruction of the teeth, Medicare will cover that. So you can see those are very extreme and very limited cases. All right, so when it comes to dental, there are some options that you have. One way is if you decide to get an Advantage plan. Now these are called C plans. A C plan is also called a replacement plan, a private health insurance company, and most of those plans will actually throw in some dental allowance. I really don't call it a dental plan because it's typically not, and most of the plans, the dental allowances are going to be at about $1,000, meaning most of the Advantage plans give you about $1,000 of dental allowance. Now, some of them may be a little bit higher. I've seen some sometimes $1,500. Occasionally you'll see one that's at $4,000, and that's people who qualify for Medicaid as well as Medicare. So if you're not on Medicaid, that benefit is typically $1,000. And that $1,000 is an annual allowance. So the first $1,000 that company will pay out of pocket. After that, you'd be responsible. Now, one thing you've got to really pay attention to on the Advantage plans is the majority of them require that you see a network dentist. I had somebody recently that there was a $1,000 benefit, but they couldn't find a dentist that would take the plan that was close to them. And so you got to be aware. So that's the way Advantage plans work. And again, may have a little higher benefit. Just make sure that you're happy with the network that they're offering you. Okay, so other options when it comes to dental, and this is what many people do, and that they actually get a dental plan. Now, the way dental plans works is this way. Number one, you have what's called preventive services. And those preventive services are normally covered at 100%. Most of the dental plans are going to give you 2 cleanings a year and 1 full set of x-rays. Okay, and that's immediate coverage. The second type of services covered by a real dental plan would be what we call basic services. Now, basic services would be your low-cost items, extractions and fillings and those kind of things, and those are normally covered at 80-20. So the plan would pay 80%, and then you'd be responsible for 20% up to the plan's maximum allowable benefit. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. And then the third item is going to be called major services. Major. Now, major services would be your root canals and crowns and periodontal work, those kinds of things, implants sometimes. And so those are going to be covered at 50-50. All right. Now you got to keep this in mind. So the plan pays 50, you pay 50. Keep this in mind. Some of the plans cover these things immediately as long as you're coming off of other dental insurance. But if you have no other dental insurance, then sometimes there may be a small waiting period before they'll cover these items. Could be 6 months here, could be 12 months there. And again, if you've had other employer coverage, they typically waive that. But this is what I would call the dental plan. Now, the thing you have to pay attention to is what will be the annual maximum. In other words, when that company pays 80% on basic and 50% on major, what will they spend on you? Well, some plans are around $1,500. The one we really like is $2,500 on an annual basis plus cleanings. And so you got to pay attention. What's my coverage going to look like? When is it going to start? What's my annual benefit? Now, these plans are going to range, folks, and this varies all over the country, but these are about $45 to $55 a month, and this would be per person. And again, if you have healthy teeth and you don't have any problems other than you get cleaned a couple times a year, it may not make any sense to get a dental plan. But if you have ongoing problems, then you'll probably get that money back out. You're going to spend, $600 a year, and if you've got a $2,500 plan, you'll probably get your money back out of it. Because again, Medicare, very limited. Advantage plans, again, I call an allowance, not really a plan, because of the limitations in the network. Over here, if you have teeth problems, it probably will pay off for you to get that dental plan. Now, the second item that you have to be aware of that's going to be limited by Medicare will be Medicare is not going to cover for eye exams for eyewear. Now, Medicare will pay for medically necessary eye exams all day long, no problem. But if someone's just going in to update their prescription to make sure their eyes are healthy, that's not going to be covered by Medicare. You'd be out of pocket yourself on that, maybe $40 or $50. Sometimes when people get eyewear, they throw in the eye exam for free. But again, Medicare is not going to cover it in this one item here, eye exams for eyewear. All right. Now, when it comes to original Medicare, you've got to be aware of this. Medicare is going to cover all kinds of eye disorders as well as eye diseases. In fact, all of them. In fact, right now, the top 5 would be what's called a refraction errors. This would be when someone has astigmatism. They may be nearsighted, farsighted. That's going to be all covered by Medicare to treat those, typically with glasses. Sometimes eye diseases are going to require salves or maybe drops. Those kind of things can be covered by Medicare or through Part D plans. And so we've got wonderful coverage when it comes to cataracts. Medicare is going to pay for the cataract surgery. They'll also pay for a new eyewear, be it contacts or lens and frames. After cataract surgery, if you have glaucoma and you have that pressure in the eye, Medicare is going to pay for the treatment of that. A lot of people as they age get what's called macular degeneration. And that's in the wet form or dry form. Again, Medicare is going to cover that very, very well. Even if you have wet macular and you have injections in the eye, that's going to be covered by Medicare. And so again, cataracts, glaucoma, wet macular degeneration. Some of people have diabetes and you have diabetic retinopathy. Again, that's going to be covered by Medicare. So the only thing not covered by them, again, is going to be those eye exams. So we've got wonderful coverage by A and B of Medicare, and then if you get the supplemental plan, that supplemental plan is also going to pay what Medicare did not cover on diseases and disorders. Now, one thing that Advantage plans will do is, again, they're going to match all this right here, and so what's going to happen is this: they will throw in one routine eye exam, okay, and most of them do not include dilation of the eyes, but again, a routine eye exam, and then they also will give you credit for eyewear. And so typically the way that works is they'll give you $150 a year, upwards to $250 a year allowance for contacts or glasses. Again, remember, Medicare only covers it after cataract surgery, but the Advantage plan will throw that in. Now, again, you need to be happy with all the other features of the Advantage plan, but this is one that certainly they've added to original Medicare. Now, other options, so someone that doesn't get an Advantage plan, you actually can buy insurance. And there's typically 2 networks right now. You have one called iMed, and then you have one called VSP. And so most of these plans are going to be about let's just call it about $12 a month here, and this is going to be about $16 a month. Okay, so what will these cover? They're going to give you an eye exam once a year, as well as credit towards different types of lenses and frames and contact lenses, those kind of things. So again, you can buy other insurance for those items. Or if you don't want something like that, you don't have to buy it. It would just be an ancillary insurance that you can just simply pay out of your pocket. Okay, so Medicare, that's not going to cover these, but there's other ways to get them covered. All right, that brings us to the third item that original Medicare is not going to cover. They're not going to pay for hearing aids, or for any kind of a hearing exam, or what it's going to take to fit hearing aids. So there has been legislation that's been proposed. It hasn't passed as of now. And so very, very really minimal coverage, if no coverage, when it comes to this. Advantage plans, what they will do is they will put together a network of hearing aid providers and hearing aids that they will cover. And these copays right now would be anywhere from about $500 to $1,500, depending upon the hearing aid that you need. Again, they have network, and these certain products they'll cover and that you pay just simply a very reasonable copay per ear, and this would be every year, every other year, and so Advantage plans will include that. And the other options over here, what you can do, you can self-pay. There's been legislation that says now they want hearing aids to be able to be over the counter, and so there's a lot of people today that can get very quality hearing aids just going to some kind of online service or possibly at a local provider, and you can just simply self-pay for those as well. Okay, so Medicare is not going to cover for the hearing aids nor for the exams to fit them. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And then lastly, let's discuss this whole issue of long-term care. Now, when we talk about long-term care, what you have to keep in mind, we're talking about custodial care. Custodial care. Because remember, Medicare exists to cover things that are medically necessary. Medically necessary means that there's a high likelihood of recovery, and Medicare is going to cover that. But long-term care, this is going to be someone has a chronic problem. We call this having an issue with activities of daily living. This is a person that needs assistance with bathing or dressing, maybe eating or toileting, or maybe they're in a wheelchair and they need assistance getting from the wheelchair to the bed or from the wheelchair into the stool. That's called transferring. That's an activity of daily living. It's very important, but again, it's custodial. So when it comes to custodial care, there's nothing paid by Medicare, okay? And so they're just not going to. Now, if I have a medically necessary item going on, let's say that I have a stroke and I'm put into a skilled nursing facility. And so then all my custodial care will be taken care of as long as it's in conjunction with something that's medically necessary. But once I've gone through my rehab of my stroke, I'm back on my own for all my other custodial care. All right, and so medically necessary only, nothing when it comes to custodial long-term, this chronic care that people need just to make it through each and every day. All right, so what happens when it comes to other options? Advantage plans, same thing. They're not going to cover any kind of custodial care either. The supplemental plans are not going to either. And so what happens if someone wants to get long-term care covered, what they can do, they can actually buy insurance for that. There's a lot of companies out there will actually sell that. You can also, what a lot of people are doing today is they're actually getting life insurance that they can qualify. And then what they do is they attach a long-term care rider to it. And so this way you don't have to worry about a loss of premium, because if you never use it for long-term care, your beneficiaries, your loved ones, will get the death benefit. All right. And then there's another way in which you can do it. You can certainly just self-pay. Okay, you ought to be prepared to be able to do this right now, because the average nursing home throughout the country is going to be somewhere around $5,000 to $7,000 every single month. So we're talking $60,000 to $100,000 every single year. And if it's husband and wife, the average time right now they say is about 3 years in a long-term care facility. So you're literally have got to be able to set aside anywhere from $200,000 to $300,000 a person if you're indeed going to self-pay. And that's why people look for other alternatives. Or once you're broke, you can also qualify for Medicaid. And so Medicaid is a government program that will actually cover long-term care, but you can have minimal assets. Most states you can have maybe $2,000 to $5,000 in assets, and all the other money you had to spend down out of your own portfolio, your own assets, before Medicaid is going to kick in and pay anything for long-term care. So these are the things that Medicare is not going to cover. You got to be prepared for the dental, for some of the vision issues, certainly the hearing aids, as well as long-term care. So you do certainly have some options to get those items covered, because Medicare is going to pay minimally.